Hello, everyone, and welcome to the Period Repair Workshop, where you're going to learn all about how your cycles should be functioning and how to start repair. You're going to understand your cycle a little bit better after this workshop. So I'm so excited. So let's get started. So I'm Dr. LuLu. It's so nice to meet you, and we're going to get to know each other a little bit better over the next little bit here. I'm a doctor of naturopathic medicine. I'm a naturopathic physician, a functional medicine practitioner. I'm an author. I'm my own book. I'm a botanical formulator and a podcast host of The Genetic Genius, which is an alternative health podcast. It's awesome, so check it out. I also am the plant medicine director at the Veterans Healing Farm in Hendersonville, North Carolina. I own my own clinic, Dr. Lulu's Naturopathic Clinic, and my passion and purpose is helping women regain hormonal balance and vitality by discovering the root cause of this dysfunction so you aren't left guessing. Today, I'll be talking about how to improve your periods with nutrition and lifestyle changes. So grab a notebook, glass of water, relax, and let's dive in. So what are you going to be learning in this workshop? So you're going to learn, number one, how your period works and what a healthy period looks like. Number two, why birth control does not repair or regulate your period. 6 powerful daily habits you can put into practice right now for a healthy cycle. So first, let's talk about how your period works, how your cycle works, so we can kind of understand things as we're moving forward. We're going to lay the foundation. So the menstrual cycle. So every month, your body prepares for a potential pregnancy, right? That's like its goal. And your ovaries release a mature egg. Also, your hormones, estrogen and progesterone, rise and fall throughout the month. And this is known as your menstrual cycle. And there's 2 primary phases of your menstrual cycle. They are the follicular phase, number 1, and number 2, the luteal phase. So in the follicular phase, this is a time when the ovarian follicles grow in preparation for the main attraction, ovulation. And the follicular phase begins on the first day of your period and ends with ovulation. And this phase takes about 2 weeks, but it can vary from woman to woman. And a healthy period starts with a healthy follicle, period. The follicles are the part of your ovaries that produce estrogen, progesterone, and testosterone. And follicles are negatively affected by inflammation, autoimmunity, thyroid disease, insulin sensitivity, and deficiencies of these essential nutrients, magnesium, B vitamins, vitamin D, iodine, zinc, and selenium. Really important information there. So even if you're even just taking a multivitamin with those things in it, that will even just there will help along the way to healthy follicles. But it's really good to check in with a practitioner like myself to see which ones you really need and to be tested to see if you are having a deficiency. Number 2 is the luteal phase. So this follows ovulation in the last 2 weeks of our cycle. And if ovulation was successful, yippee, a progesterone secreting gland called the corpus luteum then forms. And if you remember nothing else, remember this one thing. This is how you make progesterone. So progesterone is that feel-good hormone and for overall well-being, pregnancy, and healthy periods. So it's really important for us to have progesterone. And the luteal phase lasts approximately 2 weeks, like I said. And how long the luteal phase lasts is really determined by the lifespan of the corpus luteum. So the health of that corpus luteum is affected by the same things that affect your ovarian follicles. And if pregnancy doesn't happen, there's no egg and sperm connection, the lining of that uterus then shreds and the next menstrual cycle then begins. So let's look at what a healthy period looks like. So 21 to 35 day cycles with 2 to 7 days of bleeding. That's ideal. A cycle shorter than 21 days or longer than 35 is considered irregular. So menstrual fluid should be mostly liquid, no large clots, and a large clot is ranging from a dime to the size of a quarter. And once the flow starts, the menstrual blood should be light to bright red. So you don't want like dark, dark, dark red. That's a sign of old shedding of the lining of the uterus. And blood loss should not be more than 50 milliliters or 3 tablespoons over the entire course of your period. So menstrual bleeding often seems like a whole lot more than that really is. So, if you're thinking or wondering how much bleeding, I'm going to talk about how to kind of measure that. So also minimal discomfort. So some discomfort is to be expected, but severe pain is not normal. So common period problems. So during PMS, that's when a lot of women experience the most, I would say, disturbing part of their cycle. And that can be from breast pain to moodiness to bloating, food craving, salt, sugar, chocolate, comfort foods, fatigue. Now you can have some, mild fatigue, but anything that's exhausting and where you can't function, that's of course not normal. And headaches can be common, but anything that's debilitating, again, is not normal. Acne, so acne on the face, breakout, or on the back, and sleep disturbances as well. So let's talk about no periods or irregular periods. So what does that mean exactly? So it's not uncommon to periodically miss a period. It can happen. Things happen in our life. Our body's changing. Maybe we're stressed, going through a life change. Anything can make us miss a period. Or for periods to become irregular from time to time. So that's another reason it's so important to keep track of your cycles with an app so that you can have that data to make sure that things are normal. And sometimes menstrual irregularities are due to normal fluctuations and are not the cause for concern. But other times, they're a sign of imbalance, and that's the key there. And you want to call your doctor or check in with me to see about those irregularities. If your period is shorter than 21 days or longer than 35 days, it's considered irregular, okay? So heavy or painful periods. So periods are considered heavy if bleeding lasts for more than 7 days, or if blood loss is greater than 80 milliliters, that's at 3 tablespoons. So how do we know that? So for example, if you're using a heavy pad, you're having to change it every couple hours. It's like leaking through into your clothes. Same with a tampon if you're using that, or a menstrual cup. Those are signs that you're bleeding you're having a heavy bleeding. Also, if you're feeling very fatigued during that cycle time. Also, if you're having a lot of spotting, like a week of spotting before your cycle starts, that's another sign that there's some irregularity in your cycle. So heavy periods can be due to different things, of course. The most common is failed ovulation. And anovulation is common with PCOS and during perimenopause. So you want to make sure if you're having failed ovulation that you're checking both of those things or even deeper with your practitioner. And if you do not ovulate regularly, progesterone levels then drop. So low progesterone, as well as the release of pro-inflammatory prostaglandins, these are part of our cholesterol and lipids. They're hormone-like substances. And during your period, they can cause cramping and pain. So let's talk about birth control, a really important topic. So can birth control repair or regulate your periods? Well, since you don't have a period while taking hormone birth control medication, the answer is no. So here's the scoop. Let's break it down. The popular birth control medications used to regulate periods suppress your natural hormones. So the amount that your body is regularly trying to release is then suppressed. You get some relief from symptoms because your hormones are suppressed. Okay, so if you're that's a lot of times why physicians might put you on birth control if you're having very, very heavy cycles and a lot of extreme symptoms. The bleeding during birth control use is called withdrawal bleeding. And during the placebo week or the break week of your birth control program, no hormones are released. So the withdrawal of those hormones then triggers bleeding, and this is not a regular period with a follicular and luteal phase. And the bleeding is programmed because of those synthetic hormones. It's programmed each month by that medication. Nothing has been repaired or regulated. And when you come off of birth control medication, your imbalance is still there. It never went away. So let's talk about 6 powerful daily habits for healthy periods. So number 1, eat a hormone healthy diet. So 1, you want to eliminate refined sugar. So sugar addiction can lead to insulin resistance and other hormone imbalances. So if you have PCOS and other blood sugar issues, I really suggest eliminating all sugar, all across the board. And if you need help with that, just reach out to me. And even natural sugar, because that's still sugar. And if you don't have blood sugar imbalances, you can substitute raw honey, 100% maple syrup, organic, of course, date paste or blackstrap molasses for refined sugar. And number 2 is reducing alcohol intake. So alcohol is the fuel to the fire for hormone imbalance. Just 1 alcoholic beverage per day raises estrogen levels. And you want to order mocktails or sparkling water when you go out with friends. So reduce caffeine intake is number 3. Overconsumption of caffeine can lead to cortisol imbalance. That's our stress hormone. And it can lead to anxiety and poor sleep, insomnia. So I love like chaga coffee or roasted dandelion coffee. If you can't get through the day without caffeine, that's a sure sign of hormone imbalance. Like if you're just like, oh my God, if I don't have this cup of coffee, I'm never going to make it through the day. Then you need to really investigate what's going on. Number 4 is meal prep and cut down on eating out. So processed foods when you eat out and fast foods do not provide the nutrients your body needs. You are not controlling what they're using and what they're putting into it. So without the right nutrients, your body simply cannot manufacture the hormones necessary for a healthy period. So number 5, eat enough, but don't overeat. So both restricting calories and overeating can lead to hormone imbalance, and it's essential to eat the correct amount for your body. So let's talk about number 2, get the right nutrients on board. So these are the main nutrients I recommend for really balancing your cycle. And if you need help about figuring out which ones to take or recommendations, please message me and I can help with that, or send me an email. Zinc. So zinc helps regulate the HPA axis. That's our stress response axis. It's the hypothalamus, the anterior pituitary axis, and the adrenal system. And it reduces inflammation. So zinc nourishes the ovaries for healthy ovulation and progesterone production. Zinc is essential for hormone synthesis, so that's a really big one. You want to make sure you're getting your zinc. Magnesium supports hormone health by reducing pro-inflammatory prostaglandins, relaxing muscles of the uterus, preventing constipation, and supporting the adrenals. It's great for the mitochondria, the energy powerhouses of the cell. Vitamin D. So vitamin D has shown to reduce pain, period pain. And vitamin D can be found in cod liver oils, tuna, eggs, and salmon. Lots of different great fats. Your body also naturally makes vitamin D when you're out in the sun. So if you have menstrual concerns, you make sure you have your vitamin D levels checked. Now, I like to have my patients in the sweet spot of around 50 and above if you're having a lot of hormonal problems and issues and other health concerns. Now, make sure that you check in the workshop I put in there specific handouts for these vitamins, so that way you can know what foods to eat, and that will give you a lot of help in that direction. Iron is essential nutrient for women who menstruate because we're losing blood. So eat plenty of iron-rich foods. Do not supplement directly with an iron supplement unless you have a confirmed iron deficiency. It's really not good for your system, and it can cause a lot of constipation. I like a product called Innate Iron Response. That's a great one. Also, there's a liquid herbal iron that I like by Gaia Herbs as well. So reach out to me if you need help with iron supplementation. So iodine, the thyroid is connected to the iodine, but it's not all just about the thyroid. Iodine is an essential nutrient for ovarian follicles and breast tissue. So iodine also aids in the detoxification of estrogen, making it beneficial for excess estrogen. And ocean vegetables are an excellent source of iodine. So that's the seaweed family. So number 3 is all about sleep. So sleep is 100% essential for hormone health. It stabilizes the HPA axis. That's our stress axis. It helps balance our cortisol, our stress hormone, and our melatonin. It improves insulin sensitivity and sugar balance. Sleep regulates the release of progesterone, estrogen, and luteinizing hormone, or LH. So really, how many hours do you need, right? Sometimes people are like, well, I don't know how much I need. What's the recommendation? Is your sleep interrupted? That's what question you want to ask yourself. Are you being interrupted by kids, or is your room hot? Are you having hot flashes? Do you have animals? Do you have a sleeping partner, that snores? It could be all kinds of things. So you want your sleep to be uninterrupted throughout the night, and shoot for at least 7 hours of uninterrupted sleep. So if you have trouble sleeping, you could consider some natural sleep aids such as melatonin in a low dose, magnesium, and valerian. And you can check in with me about that if you need specific recommendations. Number 4, move your body. It's so important to move your body, and it improves insulin sensitivity. It helps with sleep. It increases circulation. It's great for the joint system. Reduces inflammation. It reduces stress. It helps you lose weight. I mean, there's so many benefits of moving your body. Number 5 is all about reducing stress. Stress is key. Remember, I talked about the stress hormone cortisol. So it's important to reduce stress to be able to have proper hormone production and regular hormone production. So here are some examples of things you can do to reduce stress. So one, you could do a 5-minute breathing practice. So that's in the morning or the evening or any time throughout the day where you're feeling stressed. You could do a restorative or yin yoga. You could keep a what's good journal or a gratitude journal. Practice daily affirmations. I have some great meditations on my website, so make sure to check out those, also on my YouTube channel. And do things that you enjoy. Life is too short not to have fun and be adventurous. So learn to let go of things you cannot control, because that's a big part of stress. When you're trying to control everything around you, you get stressed because you feel like you're not controlling it. So you got to let go of that control. Number 6 is ditching the toxins. So using organic beauty care, use only natural household cleaners, use safe cookware such as glass, ceramic, and stainless steel. Do not drink out of plastic bottles or heat foods in plastic. Install a high quality filter to purify your drinking water so you're not getting chlorine and excess other chemicals. And then purchase organic foods whenever possible. So toxins are really important for our cycles because when we have extra toxins in the body, they hold on to the fat and they decrease our body's ability to naturally make great hormones and produce a healthy follicle. So that's really important you can even do, if you're interested in doing a short detox, connect with me and I can get you started on a detox to really get things flowing. So if you're needing more help repairing your period and cycle, please reach out to work with me. And these are the things that can happen when you start working with me. Imagine easy and predictable periods, endless energy and better moods, freedom to live your life. So today I presented you with 6 powerful daily habits for healthy periods. And I believe if you hold space for these healthy habits, you can change your period for the better. But I also know how difficult change can be. Sticking with a healthy diet, quitting sugar, living a healthy life can be hard, especially when you don't have someone like me on your team and you're busy. So you need support. You need help planning meals. You need an easy step-by-step plan, and that's where I come in. So I am the solution that you need. So if you're ready to take your body to the next level of health, think about how amazing, again, your body, mind, and spirit, your hormones could feel with nourishing foods and healthy habits. So if you're ready to love the body you're in and feel better and amazing than you have in years, it's time to try my proven system. It's worked for me in helping me repair my cycles. It's worked for countless of my patients, and I know it'll work for you too. So schedule a discovery call with me. Find out how we can work together to boost your metabolism, help you have hormonal balance, and you can get my free weight loss protocol package with a quiz, lab tips, and my expert weight loss protocol. Shoot, that's not supposed to be in there. All right, I'm just going to trim that out, and I'm going to go back. I'll just trim it out. So if you're ready to work with me and really take your health to a next level, feel amazing, just connect with me and schedule a free 15-minute consult and discovery call to find out how I can help. So what happens if you do nothing, right? So nothing changes. Your periods basically stay a hot mess, and you continue to suffer with irregular cycles, mood swings, fatigue, heavy bleeding, headaches, and the period flow. You stay confused and stressed about your health. So book a free discovery call with me today and get 10% off your initial consult. So connect with me. Need more help getting started? Book an appointment with me. Again, make a free discovery call or an initial consult. Follow me on Instagram at Dr. LuLu Shimmick. Follow me on Facebook. And for more health tips, check out my blog. So thanks for attending today for the Period Repair Workshop. I hope that you learned a lot and that you are going to be able to have the great tools you need to get your cycles back on track.